Hey everybody, welcome to episode number 2. My name is Dr. James Starrett.
And I'm Dr. LeGrand Peterson, and let's just get started.
Yeah.
So today we're going to talk about PRP, aka Platelet Rich Plasma, what it is, who's it for, what it consists of, all the things that you need to know about PRP. And Dr. Starrett, I'm going to ask him questions because he's been doing a lot of this for quite some time now. So first off, Dr. Starrett, what is PRP?
Yeah, so PRP, platelet rich plasma, basically what you do is you get your blood drawn and you centrifuge out the platelets. And with these platelets, there's tons of growth factors and anti-inflammatory cytokines and beneficial portions of the serum that can have the ability to treat soft tissue injury and stimulate new tissue growth. So basically all the red blood cells, which are pro-inflammatory, are spun out.
Okay.
Yeah, so that's what it is in its essence.
Okay. And so who would this be for? Like, who would it basically, or like how does it actually work for people who might be seeking for something like this?
So it can be used by a wide variety of people. Okay. So basically, the way that PRP works is it's basically going to recruit stem cells, your own stem cells, to the area of injury where it's applied. So it's injected. Typically, it can be used in many different ways. It was actually started out being used in myofascial surgery, in a lot of dentistry procedures. Okay. Yeah, so there's a lot of the research is through that actually. It's been going on for like 30 years. People have been using it for like 30 years.
Really? 30 years?
Yeah, it's only.
I had no idea.
Yeah, a long time.
Wow.
So it's only really here in the last decade or so that we've been toying around with it
in different parts of the body,
right? In different parts of the body, and there's quite a wide variety of research out there, some for, some against, but and the reason for this is that people are using different concentrations of the PRP, different platelet concentrations. They're using different isolation methods. Okay, but clinically, what I've seen is it works really, really well. And who it can work on, it really depends on age. Yeah. So when we're younger, we're going to have the highest concentration of stem cells, and our ability to heal is at its peak. Okay. When we're young. Okay. And it's slowly. That's why we age. We start to lose our ability to regenerate. Right. Yeah.
We start degenerating.
We don't have as many.
Unfortunately,
we're not producing. Our cells aren't as healthy. In the mitochondria, we're having less mitochondria. We're having aging, and we have less stem cells in the body. So PRP on someone who's our age, maybe someone who's in their 30s, is going to be much more robust
to accept it.
Right. Okay. Than as if you were 70, 75 years old. Okay. That's not to say that it's not clinically valuable. It may actually be quite valuable to someone like that.
So somebody that has absolute no cartilage in their knee, could they benefit from something like this?
It's, from what I've seen, if there's no cartilage left, then this might not be the procedure for you. Because
then there's nothing really to regenerate, right? If it's completely gone, it's gone. There's nothing to really regenerate.
That's true. I think that the degree of to how much you can regenerate with PRP, when it's that far gone, you're looking at if you really want to throw a Hail Mary, there's other biologic procedures. Other autologous procedures where you're extracting stem cells that might be more beneficial for you, but those are much more expensive.
Right.
And we can talk more about that maybe in another episode.
Okay. Right. Now, as far as just, so we talked about what PRP is, who's it for, but again, what kind of procedures or like what are the different options that people might use PRP for? Because we know it regenerates, right? That's what you're talking about. It's regenerating growth in an area that might be whether partial tearing in the knee that I've heard a lot about, where it's partial tearing and then of course can regenerate growth in that. But what are some other typical stuff that you see that PRP typically can be used for?
Yeah, so I see it used in a lot of different avenues. So you kind of have the musculoskeletal applications where it's injected into an area of soft tissue injury, whether that be muscle damage, tendon, ligament, maybe some cartilage, like a tear here or there.
Okay. So somebody who's thinking about getting surgery, like if they're needing knee surgery or back surgery or something like that, is this an alternative option possibly for them?
So the answer is it depends. It depends on the case. You know, you need to be evaluated typically with an X-ray or MRI. We always take a look on the ultrasound here in the office. If somebody has a tear, for instance, like at the rotator cuff, and it's less than 50%, and they're between the ages of 20 and 70 years old, I think that PRP's perfectly logical choice, especially if they're healthy.
Right.
But yeah, definitely, like if you have a small muscle tear or a muscle pull, I mean, it's honestly like endless to what you can use it for. Okay. And what I've seen it work on. I mean, I've used it on myself. I'm quite a bit. I love the experiment, and I've had a torn meniscus that I've used it on. I've had rotator cuff tear that I've used it on. And I surf a lot, and so sometimes I'll pull a muscle, especially if I'm a little out of shape, and I go out and surf for like 6 hours at a time. You pull a trap or something like that. I'll put a little PRP in there.
Yeah. Okay. Awesome.
You did some PRP on me the other day.
That's true. I did for the first time. Was able to kind of learn. We've been, Dr. has been kind of teaching me on with PRP, and I was able to do a little bit on him, injection therapy. And I guess you're feeling a little better.
No, it was. Yeah, I actually I tweaked my shoulder surfing, and I hadn't been in a little while, and so I was like, "Oh, this is a perfect opportunity for Dr. Legrand to see this stuff work in action and get a little experience." So, but my shoulders, it's feeling back 100%.
Good. So, besides the musculoskeletal, what are some other options of using PRP?
So other ways that I've seen it used and clinically used it is more on the medical aesthetic side.
Okay.
And so it's really, really great for if some people have heard the vampire facial, but you're only allowed to use that term if you pay the vampire facial people. But it's a PRP facial or PRP facelift, basically, where you're taking a microneedling machine and you're microneedling the PRP into the skin.
Okay.
And then with a facelift, you're actually going through and you're injecting the PRP along deep wrinkle lines, or along any scarring, or areas of where complexion needs to be improved. Okay,
so kind of like a natural way of doing a Botox in a sense?
I think honestly, this can be amazing. This can be amazing. Botox, it's a toxin. It's a toxin at the end of the day, and It definitely has its areas in medicine. Like I really like Botox for like some people get really bad migraines and they can get some Botox in different muscles that really alleviate their symptoms. That's great. But if you're just injecting it aesthetically, it's everybody's choice. But for me as a naturopathic physician, or us as naturopathic physicians, I don't find it to be the most naturopathic. So if you're injecting PRP, your own platelets, like what's more naturopathic than that? Yeah. It's you. You're injecting you, and you're kind of cheating the system, right? Yeah. And this goes for any procedure with PRP. Like, you're basically hacking your own body. You're taking your own growth factors and you're putting them into an area that you want to heal. But aesthetically, we see amazing improvements in complexion. Yeah. So if you have sun damage, aging spots, acne. Oh my gosh! Like people with really bad acne from their early their puberty years. You can go ahead and do several treatments with the microneedling specifically.
Really? Wow!
It's amazing. Yeah.
Yeah, especially a lot of that scarring that you get with kids who deal with severe acne. It sounds like something that they possibly could use.
It can really improve. Wow. It can really, really, really improve the look of the skin. Okay. And then when you're taking it a step further and you're trying to decrease fine wrinkle lines and lessen the deep wrinkle lines. Okay. It can work really well.
Okay. So besides aesthetically, what else can it be used for?
Well, so another thing that aesthetically,
face,
including face. So
besides the face,
so we also use it for the scalp as a hair regeneration procedure.
Now, if somebody was completely bald, can they benefit from that?
Unfortunately, we really like to with this one specifically. We really like to under promise and over deliver, because
Exactly.
I mean, hair loss can come from a lot of different avenues, and obviously we want to check with all of our patients we want to figure out why they're losing hair.
Yep.
And for a lot of males, it's just there's a genetic component to it.
Yep.
We start to lose. And as it thins, in that thinning process, that's the best time to tackle it.
To start doing it. Okay.
Yeah, start doing it then.
Because that's degeneration. I mean, your hair is
Right.
starting to degenerate, and so this is something to regenerate when there might be something still there
Exactly.
to utilize this procedure.
But if you're bald, if you're
Yeah.
100% bald, if you're just
Yeah.
not growing hair in an
Right.
area,
There's nothing. It's just like it's just like with the people with having
no meniscus.
no meniscus or
That
any
shit-
cartilage. There's nothing to regenerate off of.
Right.
So
that ship may have
makes
sailed.
sense. Yeah. Exactly.
There's other, but then again, like there's other options for those people at that point.
Right.
PRP may just not be the best one.
Right. Okay.
Yeah.
Okay. So we got the joint, muscle, face, skin. Any others?
Yeah, so I mean, there's definitely a wide variety. Women with wrinkles and complexion issues along the breasts can get PRP done.
Okay.
It's used for wrinkles in the hands.
Okay.
Some people want to improve the appearance of the backs of their hands.
Okay.
As you age, the skin can get a little loose.
Yep.
And just it's a cosmetic thing.
Yeah.
You're just going in and you're injecting PRP.
Right. Wow, that's awesome.
Yeah.
Okay.
It's also I left this out. The genitals. So there's different procedures you can do with PRP where you're bringing healing to the penis or around the clitoris to basically improve sensation.
Okay.
You can for males erectile dysfunction.
Okay.
It can
Really?
really help.
Wow.
Out. Oh yeah.
Wow.
Yeah.
I know that's a problem for a lot of people trying to find different procedures, but doing something like that you found to be a little beneficial for them.
Yeah.
Okay.
Yeah, and you know what? It sounds like an incredibly painful procedure, a terrible procedure.
Yeah.
But it's really not.
Okay.
It's really not. For the penis, there's layers of muscle that we know how to inject into, and really at the end of the day, it's not a lot different than injecting into an arm. Okay. You're being careful.
Right. Exactly.
Being careful.
Okay.
I should add that these ultrasound, these PRP procedures should be done under ultrasound guidance.
Okay.
In my opinion, whenever possible.
All right. Well, thanks, Dr. Stret. Talking about PRP. Thanks for listening and watching, whichever your favorite type of media you're watching this info on. But we're going to close out. If you are in the area in Snoqualmie, we're out here at Blue Water Medical and looking for doing these kind of procedures. We're willing to talk to people about it. You can give us a call or stop on by definitely to get some PRP treatment. So until next time, this is Dr. LeGrand.
And Dr. Stret.
All right. See you later. Thanks.
Bye.
Bye.